Welcome to the Progressive Rehab and Strength podcast. I'm your host, Dr. Rory Alter, head clinical coach here at Progressive Rehab and Strength. Interviewing today, Martin Hsieh, a physical therapist and competitive powerlifter and father of 5. And in this episode, what we're going to be talking about is Martin's experience with an Achilles rupture. Was it a full rupture or just a partial
Yeah,
tear? Full
full
rupture.
rupture. Full
Full
rupture.
rupture. And you have a pretty unique story because you decided to go the non-surgical route.
Correct.
So we're going to dive deeply into that. But what I love about you is that you are a physical therapist and a powerlifter who goes through or went through something massive, a massive injury that could potentially really impact your powerlifting career and your ability to participate in the sport, your family life, your work life. Like, I'm sure it impacted everything that you were doing because, when you have a tear, especially in the Achilles tendon, you're pretty much non weight bearing for a little bit. But
Yep.
before we dive into that, and you've actually been able to compete 2 times since you rehabbed your rupture non-surgically. So
Correct.
before we dive into that, thank you so much for coming on the podcast. I'm very excited to chat about all of this. But why don't you go ahead and introduce yourself? Tell us a little bit about your educational and professional background and a little bit about your hobbies that may or may not include powerlifting and your family life.
All right. So my name is Martin Hsieh. I graduated from University of Maryland with a genetics degree.
Oh, interesting.
Yeah, in 2008, and then got into PT school, and then graduated from University of Maryland Eastern Shore in 2012. And I've been an outpatient therapist since then with the same company. Yeah. So what is that? 11 years now.
Mm-hmm.
Oof. Yeah.
I know. I graduated
Uh,
in 2012 also from PT school. So it's crazy that we had just we like are in our 11th year. It's just,
yeah, that's crazy to me.
we're old folks over here.
Yeah. uh, so I didn't get into powerlifting maybe until 2014 is when I first started training.
Mm-hmm.
Yeah. And prior to that, I would say my main hobbies were basketball. I played basketball growing up. I know not wasn't my wisest choice looking back now, being
Did
at
you have,
5'6".
oh yeah, so you're pretty short for a basketball
Yeah,
player.
right.
When you played basketball, did you have any injuries?
Just the normal, like jumper's knee
Mm-hmm.
like a year or two when I was
Mm-hmm.
growing up. Osgood
Mm-hmm.
splatters.
Mm-hmm. Mm-hmm.
I actually dislocated my elbow senior year of high school, and then freshman year of college, back to back. It was right and then left.
Oh, geez.
Yeah,
Geez.
yeah.
So
And
how
then
did those impact? Did you have physical therapy for those?
I did not. I kind of just like worked it out on my own.
Mm-hmm.
Kind of like forced use therapy,
Mm-hmm.
kind of
Yep.
deal.
Yep. Yep. Well, honestly, sometimes that's the best kind of therapy because I
Yeah, I
feel
just
like people stop using things and then they get worse. Um,
right.
so.
And that's what I tell all my frozen shoulder patients.
Mm-hmm.
It's like you don't use it, it's gonna get stiffer. Just keep
Mm-hmm.
using it, but to
Mm-hmm.
your tolerance.
Yeah.
I also golf for a little bit. I've been golfing since maybe middle school.
Okay.
Took a little break. So when I found out I was having twins, I kind of picked up powerlifting more because it's more, it's not as time consuming, right?
Mm-hmm.
Compared to golf,
Mm-hmm.
right?
Mm-hmm.
And basketball. Basketball, you can't really play by yourself. You got to
Right.
drive to the gym, half an hour trip, play for
Yeah.
like hour and
With
a half.
everybody's schedule. It's like
Right,
a scheduled time versus just going to the gym when you have a minute.
right. So I kind of started setting up my home gym
Mm-hmm.
back in 2013 when I found out my wife was pregnant and the deal, and then been training pretty much at home and at the clinic exclusively since then.
Okay.
Yeah,
So what type of clientele do you work with at your outpatient clinic?
I work for a corporate, physical therapy clinic.
Mm-hmm.
So really anybody, anywhere from reverse shoulder to your motor vehicle accidents.
Mhm.
About 3 years ago, I picked up doing functional capacity
Mhm.
evaluation
Mhm.
for work comp, and that one of my specialties.
Cool. Very
And
cool.
then geriatric patients, so pretty much all over the place.
And in terms of the in the type of treatments that do you integrate barbell training or the principles of barbell training and progressive overload into your practice?
I do. I usually do more like trap bar deadlift,
Mhm.
if anything. Yeah,
Mhm.
trap bar. It's just I would say friendlier. It's not as
Yeah.
scary to a
Yeah.
lot of the patients,
Mhm.
because you can introduce the idea and they're like, oh, I'm not lifting that thing.
Right. Yeah.
So then it's kind of have to pick and choose who you're working with to
Yep.
really get them to buy into lifting something. But at the clinic, we have a sled,
Mhm.
like a prowler sled, and
Mhm.
then pretty much everybody pushes the prowler at some point.
Good. Yeah, I think
I don't really,
the prowler is
as
amazing.
in,
You can use it for shoulder, you can use it for upper extremity,
right.
spine, lower extremity, um, long, respiratory, like really anything,
Yeah,
cardiovascular.
yeah, yeah.
So, yeah.
And so a lot of them are older patients. I usually start them with kettlebells.
Yep.
So just doing, easy. I don't want to say easy, but it's hard for them. But
Yep.
just like a goblet squat,
Mhm.
just to the chair and come back up kind of deal. And then, you start with, right, 10 pounds, and
Yep.
then you go up to, maybe up to 25, see what they can tolerate
Yep.
for the most part.
And then eventually you'll be like, well, the bar weighs the same.
Yeah, yeah, yeah.
I know it's like a
Yeah,
sneak attack.
yeah. It's a tough one. Yeah,
Yeah.
because a lot of them never trained before, right?
Mhm.
So then getting them to get over that Dom feel,
Yep.
like the next time, it's really hard for them to buy in because they'll come back and be like, I was so sore and I was betting for 3 days. Can we not do that again? And I'm like, okay, we'll see.
All right. So, before we dive into your injury, can you tell us a little bit about what your typical training program for yourself looks like?
All right. So right now, I've been kind of doing my own thing for the last maybe 4 years now.
Mhm.
I kind of just write my own stuff. Uh, Usually like a linear progression for the most
Mhm.
part. But one of my main things is that I typically split up my session, right?
Mhm.
So one of the things I do is I list all the things I think I want to accomplish for the week.
Mhm.
And then I just knock them out, check them off the mark. It doesn't matter like when I do it.
Mhm.
It just matters that I do them,
Right.
right? So it might not be ideal
Mhm.
for a lot of people, but I personally don't really have that much time to go train for 3 hours, even
Right.
even if it's in the home gym environment, right, in my
Right.
basement.
Well, I don't think we
Uh,
mentioned how many kids you have. You have at least one set of twins because you mentioned that, but I think there's something unique about you that everyone else
Correct.
should
Yeah.
know.
So I have two sets of twins. Yeah.
Uh-huh.
So my older boys are identical twin boys. They're turning 9, and then I have a middle. He's 6, and then I have another set of twins, a boy girl. They're 3.
Awesome.
And then we just got that puppy in the back who's
Who is very cute.
giving
I've been thoroughly entertained by is it a
just
boy or girl?
the boy. He's giving me a run for my money.
I've
Oof.
definitely been entertained so far watching him in the background here. Okay,
Yeah.
so
So
I actually really like that concept of just writing it down and making sure you just accomplish it all versus, having a set order on specific days. And I think for a lot of people who struggle with time management when it comes to training, that could reduce a lot of the mental stress that comes along with training. Sometimes a lot of people experience a feeling of failure if they're not doing the
Right.
things written in the way in which they're written on the program. So I actually really like that concept. But I mean, this is a whole other conversation that before we turned on the podcast, we could have a whole other conversation about
Ooh,
time management in barbell training as a parent of many's, multiples and singles. um,
ooh.
so tell us a little bit about your Achilles tear. So when did that happen, and how?
So it was July 19, 2022. So
Oh,
almost a year
wow,
now.
almost a year.
Yeah,
Wow,
yeah,
that's
I
pretty
know.
awesome.
Yeah, and I tore it playing basketball. I was in a basketball game. Yeah,
Mhm.
I caught the ball on an inbound pass.
Mhm.
Yeah, and then just made a move to the right, and then as
Mhm.
soon as I made that move, it felt like someone had like stepped on me.
Mm.
Yeah, so then I kind of blacked out momentarily for maybe like half a second. Right,
Mhm.
I'm on the floor, and then I'm on the floor rolling, like waiting for the ref to call the foul, and
Mhm.
I'm gonna shoot these free throws when I get up. and then I turn around and I kind of like sat up, and then I realized, okay, there was no one around me. You know, so
Mhm.
when I realized like there's really no one around me, I kind of had a feeling. I was like, ooh, that's not good. Based on the feeling of like the description, right?
Mhm.
And then the fact that no one was actually around me to trip me or step on me, I had a bad feeling. And then my foot was kind of numb. And so then I'm like, oof, that's not good. I got up, and then, they called timeout, and then my teammates kind of got me up, and then I put my foot down. Realized I couldn't wait there. And then so it kind of like hobble off the court with some help. And then I'm sitting on the floor. I've been telling my teammates, like, I think I tore my Achilles. They're like, really? I'm like, yeah. It's like, do you want to go to the ER? I'm like, well, they're probably just going to make me wait for 7 hours and then
Right.
do an x-ray, right? Say, all right, nothing's broken. You should probably
Schedule
go
something
get
with an
yeah, exactly. So I was like, you know what? I'm just going to go home.
Yeah.
So then I hobble out of the gym because of my left. So then I was able to drive home at least,
Drive home,
So I
yep.
just kind of limp out of the gym, and then drove home, and I told my wife, I think I tore my Achilles. It's not looking too hot. She's like, oh, are you serious? I'm like, yeah. So then, I had a panic moment for about, I would say that night, right?
Yeah.
I am, because that's one of the injuries that you really don't want to have,
Right.
right? Like that, I always tell people, like, out of the two things that like I've treated that I really don't want, one is like a frozen shoulder. I just feel like frozen shoulder, so it takes so long to recover,
It
right?
takes
That's
so
one
much
thing.
work. So much work to recover.
And then the other one is a torn Achilles.
Yeah.
I just the second one is torn Achilles. So I've seen a lot of career-ending injuries with the torn Achilles in professional basketball players, right?
Mhm. Mhm. Yeah, absolutely.
So I contacted Al Lind that
Yep,
I'm
yep.
sure you interviewed, right? So I
Yep, we had him on
contacted
the
Al.
podcast.
Yep, Al, and then another good friend of mine, Nick Kyle.
Mhm.
He's practice based out of West Virginia.
Mhm.
And then I spoke to you, remember,
Yep.
on
Yep, I do.
Messenger. And then I'm just asking about their opinion on, I knew there was a non-op option,
Mhm.
right? And then I knew there was surgical option. I just didn't know which way to approach. So
So
then
how
I
did you
contacted
decide?
them.
Yep, go ahead.
So I contacted them, and then uh Al told me pretty much, he said, at his practice, they pretty much all go non-op,
Oh,
and they have good
really?
success rate.
Interesting.
Yeah, yeah. And then Nick also told me the same thing. He said you can go non-op. It's pretty common nowadays, and apparently that's like kind of like the standard in Europe.
Mm.
Yeah. So I'm pondering. So I borrowed a boot from my friend who broke his toe the next day. I was able to
Mhm.
drive over, pick up a boot from him. So I booted myself, and then went to work the next day, the afternoon. I just kind of treated on the stool.
Yep. Yep.
I could still do my manual, my needling, and then just scooted my left leg kneeling on a stool, like
Mhm.
all over the place
Yeah.
at the clinic, and then called and got an appointment with the evening orthopedic, like kind of like urgent care kind of
Mhm.
stuff. And then the PA was able to see me. So he did the Thompson test,
Yep.
right? And then he squeezed my calf, and then I'm sitting there hoping it's a partial, right?
Right.
And then he squeezed my calf. He was like, you know what, like that's a hard positive. He was
Yeah.
like, there was no movement,
Yeah.
on your foot. I'm like, oh, that's not what I want to hear, right? I was hoping it was a partial. And he said, all right, we're gonna get you a consult set up with the doctor. So I saw the doctor the following Tuesday.
Mhm.
Okay, and in between this whole time, I'm kind of talking. I spoke with you, right, Al
Mhm.
and Nick,
Mhm.
just about my options. I'm leaning towards non-op already, right? So I sit down with this doctor in a Zoom meeting and a telehealth. And the first thing he showed me was a video of Kevin Durant,
Mhm.
a basketball player, Kobe
Mhm.
Bryant, right?
Mhm.
And then I believe David Beckham.
Mhm.
Yeah. And then he was like, like all these players tore their Achilles, right? They're all young, they're athletes, and that's really what I think the best thing is to do for someone like you, right?
So they
He said
had
you're young.
operative or non-operative?
They all had operative.
Uh-huh.
Yeah, yeah, yeah. So this doctor essentially told me that if you're young and active, right, then going the operative route is your best option.
Mhm.
Okay. So I'm like, okay. So here I am, a PT myself, right? And I'm leaning towards non-op. But then after the consult, I'm kind of a little bit, putting doubt in my head at least,
Mhm.
right? So
Mhm.
just so a big part of me is like, well, imagine how the patients feel who
Oh, absolutely.
don't, right? They don't
Yeah.
have any of this background
Mhm.
experiences. The doctor's telling them that they need surgery, so they think they need surgery,
Right.
right?
Mhm. Absolutely.
So that kind of opened my eyes a little bit on how like their narrative can really change how you feel
Mhm.
about your decision, right?
Mhm.
So then the next day, I'm like talking to my wife and then talking to other colleagues. And one of my colleagues I used to work with, she said, I just treated, I just evaled a patient who was 27, tore his Achilles, right? And the doctor thinks that he should go non operative, right? I'm like, okay, well, dude's like 10 years younger than me. And if that doctor thinks that going non operative is best for him, right,
Mhm.
then I'm going to go get an opinion with this doctor,
Mhm.
right? So if she tells me I need surgery, then I'll get surgery. That's
Right.
two for two,
Right.
right?
Right.
Then I'll get surgery. So then I showed up to that appointment like a week later. And then she's pretty much like, no, like we don't treat, you know, unless the coach or the person like really, really want surgery, everybody goes non-op, right?
Interesting.
Yeah, so she is a orthopedic doctor who also specializes in tendon healing, and
Okay.
she's based out of University of Maryland.
Mhm.
Yeah, and she said that pretty much the outcome is the same, right?
Okay.
And like the re-rupture rate's pretty low for both, right? Tear your Achilles, uh, it's always going to have scar tissue. It's never going to look the same
Right.
under the microscope,
Mhm.
right? So
Mhm.
regardless of what technique they use, whether it's open or I think nowadays they do the PARS, right?
Mhm. Mhm.
So they kind of like poke holes and then insert the clamp to pull down the
Yep.
tendon and then reattach them together, right?
Mhm.
She said because there's not a lot of skin back there, the likelihood of you having like a wound complication is high,
Mhm.
right? They could over tighten the Achilles, and you'll never have the same dorsiflexion range again, right?
Mhm.
Which
Mhm.
in powerlifting, shoot, if you can dorsiflex, squatting is going to be terrible to hit deck,
Mhm. Mhm.
right? So
Mhm.
that's another one of the factors that I kind of consider too. And then she said, like, regardless, the more important thing is going to be how hard you rehab it, right? And which
Mhm.
you and I both know, like, the surgeon can, fix anything. I don't believe in that anyway, but they can fix it.
Yep.
But then for the most part, like they can't make you stronger. You have to make
Right.
yourself stronger,
Yeah, they
right?
can't do the work after the surgery. So,
Correct,
yeah.
right? So knowing that, one, I have all the means, you know,
Mhm.
to rehab myself,
Mhm.
and two, after kind of talking to my wife, right, who's also a therapist,
Mhm.
she was like, like, I know you put in the work, number one, she said, and I know that based on your personality, if you get surgery and it doesn't turn out the way you want, like,
You're going to
you'll
beat
regret
yourself
it.
up. Yeah.
Right.
Yeah.
But if you don't get surgery and it doesn't turn out the way you want, you'll be more readily to, like, accept that mentally.
Right. Yes.
Right. Which I
Right.
agree.
Yeah.
Which I
Yeah.
agree.
Yeah.
So, as soon as, like, rewind back after I tore it, that Friday, I just bought one of those, like, simple bench that had like a leg extension attachment,
Uh-huh. Yep.
right? So then I started doing leg extensions,
Mhm.
right? Because I know I'll be non-weight bearing based on all the protocols I read like throughout that week. Like, I know I'll be non-weight bearing.
Mhm.
So I did maybe 100 to 200 leg extensions like every other day.
Yeah.
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 And just trying to decrease atrophy.
Yeah, well, so it's just everything that you're mentioning. So we just before this episode comes out on the podcast, we have a functional anatomy of the foot and ankle episode, and we talk a lot about ankle range of motion, dorsiflexion, all that stuff. And we also have a 10-minute tip episode that came out where we talked about training with one leg um, when you're non-weight bearing, but also when you can't bend your knee. So like there's two kind of
Right.
scenarios. Like you were able to bend your knee, which is huge. So
Correct.
you can
Right.
still train the other leg. So I'm curious. I want to kind of dive into how you continue to train after that. But exactly that, like, when you're non-weight bearing on one leg, we can't do barbell exercises necessarily. If you have someone who can
Correct.
load plates for you, who can walk around with the plates, if then maybe you could do a Bulgarian split squat, or you can do hip thrusts with the barbell. But if you can't carry weights around the gym, especially 45s, because you can't stand on both legs, you have to come up with alternatives. So I love that, initially, before you even had these consults with the doctors, you bought a piece of equipment that you could perform isolation exercises with. And like one of the things that we recommend in our 10-minute tip is that for some people who train at home, who have limited equipment such as just barbells, racks, and plates, it's beneficial during that time to come up with some alternative equipment or exercises that you can do. So we usually recommend to our clients who are going through similar injuries to perhaps join a commercial gym for a month or two so that they can still train their lower body without the barbell. So anyway, continue.
So yeah, it's funny you mention that, just because I, uh, in my training all these years before I hurt my Achilles,
Hmm.
I was never like a huge accessory guy,
Right.
right?
Hmm.
I
Neither are
I
we.
had yeah, I had limited time, right? So
Right.
then, if you really dive down into training, like, the one of the most important thing is specificity, right?
Hmm.
Like, skill acquisition, essentially, right?
Hmm.
And if you want to get better at squat, you squat. If you want to get better at bench, you bench, right?
Thank you.
So
Amen
so
to that.
yeah. So that was my main thing all these years, right?
Mhm.
I only got, I maybe train total maybe 5 to 6 hours a week,
Mhm.
maybe,
Mhm.
right? And then what's the most, bang for my buck,
Yep.
right? It'll
Mhm.
be the competition lift, right?
Mhm.
So I did, maybe squat 2 to 3 times a week,
Mhm.
right? And then deadlift 1 to 2 times a week, and then bench 3 to 4 times a week.
Yep.
And so that's how I usually split up my training. Maybe I'll squat Monday, bench Tuesday, deadlift Wednesday, and then kind of repeat
Mhm. Mhm.
stuff like that. So I do a lot of like one movement a day.
Mhm.
I'll start my oven, right? And I
Mhm.
come down and do a set of bench press and then go back up, right? Okay, oven's ready. I'll put my pizza in for the
Uh-huh.
kids,
Yep.
come back down, do my second set, right?
I love it.
And
I
then,
love it.
so I'm able to kind of fit in my training between a lot of housework.
Uh-huh.
I'll literally load a dishwasher, come back down, do a set, and then just
Mhm.
in between uh chores, I'll do a lot of training, especially bench and deadlift that
Mhm.
doesn't need as much warming up versus
Right. Mhm.
squat. I kind of set aside like
Mhm.
30 to 45 minutes to
Right.
train,
Yeah.
but the other two I'm okay. So before I tore my Achilles, that was like my main thing, and then after I tore it, I couldn't do barbell lifts for the first 2 weeks except for bench, right? I
Mhm.
can do like feet up bench, right? So
Right.
I'll kind of, I don't say like scoot my butt down the stairs into the basement and kind of crawl to the bench, literally, right? I'll
Mhm.
crawl to the bench because I can't put weight on it, right? And then I'll just stand on my good leg and I'll load the plate onto onto the bar, and I'll still do like feet up bench
Mhm.
or like Larson press, like
Mhm.
those I could do, and then I would do leg extension,
Mhm.
uh, and then or I'll do like kneeling deadlifts, I guess.
Right.
I'll hold the
Oh.
kettlebell. I'll kneel on the bench,
Oh,
right?
gotcha, gotcha.
Yeah, and then so my lower extremity is not weight bearing, but I'm weight bearing through the knee, right?
Right, right.
So then I can still kind
Interesting.
of train that. Yeah.
Mhm.
So then I'll do stuff like that, kettlebell stuff. I'll do rows,
Mhm.
just kneeling and do rows and chest supported rows,
Mhm.
seated, incline, dumbbell press and stuff like that.
Mhm.
But since the injury, I've really started picking up more accessories, which is a positive in the grand scheme of things
Mhm.
for
Yeah,
myself. I'm still
especially
doing, yeah, I'm sorry. Go ahead.
no, like especially as you become more of an advanced lifter, sometimes you do need accessory lifts or accessory
Right,
exercises to kind of fill the gaps or add a little bit more volume without adding so much training stress and time.
right.
And also, like, you're getting older, not for nothing. Like, I hate to say it because
Exactly.
I'm basically
No,
the same age
we
as you.
all.
I hate to say it because I am like the same age as you, but we're getting older. And, like, sometimes we just can't handle as much of the multi joint movements, the main lifts,
Yeah,
as,
yeah.
but, so anyway, continue.
Yeah, so like I would say like the total tonnage, it's getting harder to handle, right? As
Mm
you
hmm.
get
Mm hmm.
older and busier,
Mm hmm.
you don't always see like my 3-year-old still wakes up every night. So
Mm
I
hmm.
mean, so I get maybe 5 to 6 hours every
Yeah.
night kind of
Mm hmm.
deal, right? And
Well, if
never,
they're waking up, then maybe that isn't even consecutive, so.
no, no, I haven't had consecutive sleep for 9 years
Yeah,
probably.
I know. I always say, like,
So
it pretty much ends once you have a kid, then
yeah,
you're basically gonna not have consecutive sleep until you die because then once
yeah,
once they're out of the house, then you're waking up because you have to go to the bathroom or like you can't
right.
sleep or whatever. So, or you're just so accustomed to it that you basically never
Yeah,
sleep
like
again. So,
even if I go to bed at like let's say like early, like 10, right?
mm,
I have to wake my 6-year-old up so that he doesn't wet the bed.
right.
At 12, I gotta bring him up and then go take him to go,
Mhm.
use the bathroom and then come back. So
Mhm.
it, so a lot of times I'm just like, well, why should I go to bed at 9 and then have to wake up, just take a quick nap and just, I probably won't
Right.
fall asleep again. So I
Right.
just wait till like 11:30, wake him up and then take
Yep.
him. But
Mhm.
yeah, never. I haven't really had any consecutive sleep for years now.
So,
But
I have a question
yeah,
about the injury. So, leading up to the injury, did you experience any symptoms that maybe your Achilles was, you know, on the verge of something?
yeah, I've gotten asked that a lot, and the answer is no.
Mm.
If anything, I tore my left. My right one's always the one that kind of, had, my soleus is kind of tighter,
Yep.
dorsiflexion is not as
Mhm.
good on the right side.
Mhm.
Uh, but I would say, I was telling my wife when the night I tore, I was like, you know what, I shouldn't have gone to play. I was leaning towards not playing. It was a 10 o'clock game.
It's 10 p.m.
I mean, yeah, yeah,
Yeah.
yeah. So then
Fatigue.
yeah, I know. So
Fatigue
I'm
plays
usually
into it.
like a huge, and I'm a right-handed basketball player. So over the years, uh, right-handed layup, you usually take off on your left,
Mhm.
right?
Mhm.
So I'm stronger going to the right because it's my dominant arm. I'm a
Mhm.
better finisher on the right.
Mhm.
So I would say over the years, just the repetitive jumping, 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 going to the right. I'm definitely taking a toll on the left side
Mhm.
overall, right?
Mhm.
My Osgood Schlatters is worse on my left than my right. When I had like jumper's knee, it was on my
Yep.
left than my right,
Mhm.
right? So
Mhm.
then it would make sense. But my wife was like, you know what, like even if you didn't go play, you probably would have tore the same night just running upstairs,
Maybe. Yeah.
Yeah,
Yeah.
and then I'm kind of like, you're right. Like I had no soreness or in the Achilles, no nothing.
Yeah, and I
Bless
like
you.
no, it's okay, thank you. I like to tell people that when they tear something, it's not something they did that day.
Right,
That's
right.
the straw, which is why I asked that question because, I've personally experienced a rupture I had an avulsion fracture in my hip. And
Mm,
it's in every scenario that I've heard someone tear something, unless it's like that was non-traumatic. It was, I mean, I guess it's traumatic because it happened in a moment. I mean, it's traumatic, but it wasn't like you got hit, you weren't in a car crash, you weren't like someone didn't stop you and cut like in front of you.
right,
It was like a self-contained injury.
right,
And when we have these self-contained injuries, it's generally the straw that broke the camel's back and not just that isolated incident, which is why I kind of wanted
right.
to know if you had experienced anything symptom wise leading up to that. But, it's your dominant jumping leg. You've had other things on that side, such as the jumper's knee. And thinking about it, you said the right calf had been tighter historically than the left, meaning that possibly throughout outside of basketball, the left side was doing a little bit more work if there's some soreness in the right side. So overall, that leg seems to take more of the hit. And
Right.
was just kind of ready to blow. And that's usually what these tears are, is that it's just ready to go.
Yeah. And it is, and it really, that's kind of how I've been explaining a lot of things to my patients. When I do see the more advanced patients who are, end up getting hurt in lifting or
Mhm.
playing sports and stuff like that, right? They're always like, what could I have done to, what exercise could I have done to not have this happen? I'm like,
Right.
probably nothing, right? Probably
It's
nothing,
like,
right?
what
Like,
shouldn't you have done?
right. Yeah.
Yeah.
Because I had a good friend that actually hurt his back a couple of years ago, just, doing conventional deadlift, warming up with 225 and then felt his back pop,
Mhm.
and then he's asking me, he's like, like the form looked good. Like, what happened? And I was like, what did you do? What did you do before? He was like, well, yesterday I shoveled snow for 3 hours, right? So I'm like, okay, so then the issue isn't deadlift itself or the
Mhm.
load or the technique, right? The issue is that you were tired.
Yep.
You shoveled snow for 3 hours, right?
Right. Yeah.
It's the cumulative fatigue factor that a lot of times that, it doesn't matter if you have perfect form. It's just
Mhm.
when your body tells you, you know what, I don't have the load tolerance today at this moment.
Right.
then that's how you get an injury.
Yeah, and it seems like that's kind of what was going on with you. You didn't really want
Yeah.
to. You were like, "Oh, it's a late game." You were debating going or not going. You went,
Yeah.
your body was tired and it just snapped, literally.
Yeah. Yeah. And and I think going back, I was really, just bummed
Of course.
I would say for that night, but then afterwards, I know that, you know, I'm older, right? And my training is kind of like leading up to it. Like I had a really good PR back in earlier of 2022.
Mhm.
I think I squatted 232.5 kilos,
Mhm.
and I'm like getting ready for this meet. And then I had a really good peak, right? And then going into the meet, like second to last warm up, literally in the warm up room, I felt my back kind of like tweak.
I remember
Yeah. And
that.
I had to pull out of the meet, right? Like I squatted my first squat, walked it out, was able to squat it. And then the second one, you know what? I'm going to tighten my belt a little bit, put some like, biofreeze on it. And I walked it out. And then as soon as I walked it out, I felt it give again. I was like, you know what? It's not worth it. Walked it back in and then it's left. And so I'm been building back up to that, right? Like
Mhm.
leading up into July. And then the night before I, the same day when I tore my Achilles, I had just squatted, I don't know, like 185 for five, and it felt
Mhm.
really good, like a low RPE range, feeling like I'm on the verge of hitting some type of rep PR,
Mhm.
and then boom, my Achilles goes. And then I was really bummed. And then the next day I kind of like regroup, right? Like instead of playing this victim, right? And instead of thinking that I hope I don't want to feel like I identify myself as an athlete kind of guy, which I think a lot of us do, right?
Mhm. Mhm.
But sometimes it's almost that mentality is almost like more detrimental in the sense
Mhm.
that, you think you're invincible, number one, right? You think you're, I don't want to say different, right? You
Mhm.
think you're different, but at the end of the day, we're all kind of the same, right? We just have
Mhm.
different hobbies, right?
Right.
So I kind of just didn't think that, oh, what am I going to do the next year? I just kind of rolled on and set a new goal. Like,
Right.
okay, I want to squat 500 pounds again by the end of 18 months,
Mhm.
right? That was like one of my goals, right? I want to deadlift 600 pounds again by 18 months. So
Mhm.
now that's kind of what my focus is working towards that. So it kind of shifted my goal a little bit
Mhm.
more in the rehab sense than, it would be a different kind of PR, right?
Yeah, no, I think that's a really good point that I want to just recap here is that when injuries happen that really take you out of your sport, you could as an athlete, and I've certainly done this, and I'm sure at some points in your lifting career you've done this. It's like everything's over and you can like hyper focus on like I'll never be that good again, or I'll never get there again, or this is ruining whatever my goals.
right,
um, but instead of focusing on what you've lost, focus on what you can do going forward, and
right, right,
just adapting your mindset for right now so that you can get through this period of recovery. But I
right,
want to also point out, um, and I think this is interesting. So your back tweak happened in peak condition, or when you were
right,
supposed to be peaked, and you
right,
said that you hit a really good 185 easy, and you felt like you were on the verge of a rep PR that night.
right,
So you felt pretty peaked and ripe,
right.
and I think that a lot of time, and when we're peaking, generally speaking, we've accumulated a lot of fatigue for
Fatigue
this.
is high.
Yes, fatigue
Yeah,
is very, very high to allow us to peak in competition. So basically, we just allow that fatigue to dissipate for a little bit of time, usually about a week, week and a half leading up into the competition, and then we should be as strong as we can be. And I really do see, and I don't know, I don't know how many powerlifters you work with or athletes. high school athletes, they don't really have any idea of what their program is. And they technically should be in peak condition for competition season. But, and we generally see it's not usually in practice that kids get hurt, it's in competition that they get hurt. And so, from my experience, we oftentimes see injuries happen leading into meets or at competitions because people have accumulated so much fatigue. It's not usually the first week of a program or the first 4 weeks of a
Correct.
program. It's like more when you've been running that program for a long time and you don't change something to allow the fatigue to dissipate. That's when your body starts to say, you know what, too much is going on here. I need a break. And if you don't give me a break, something's going to break.
Yeah, and kind of that relaying that a little bit to patient care, even as you're not treating an athlete. A lot of times the patient comes in saying, I've been walking,
Mm-hmm.
for 3 miles every day in the last, since I can remember, kind of
Mm-hmm.
deal. Like I'm on this really good weight loss program, and then all of a sudden my hip starts hurting, right? But then I haven't done anything different. And a lot of times that's what I tell them. It's like, well, maybe it's time to
Do
change a
something.
little
Yeah.
bit, right?
Yep.
Because that's the way your body's telling you that it's tired of what it's doing, right?
Right.
So like
Exactly.
the load is too high, the fatigue is too high. So maybe take a week off, But a lot of them have this fear that, especially the patient that went from, you know, overweight to, more in shape now, right? They're
Mm-hmm.
scared
Mm-hmm.
to stop working out, right?
And
They're
that's
in
the
this
same thing
good
for
routine.
yeah, that's the same thing for for powerlifters, whether they're
Right, right,
recreationally competitive or excuse me, or internationally competitive. It doesn't matter, they fear that they're going to lose all their gains. But the
right,
amount of loss that you go through by trying to just continue to fight through something is oftentimes worse than taking a step back and allowing it to recover. So
right.
I want to dive into what your training and rehab looked like for your Achilles. So we talked a little bit about, like the first like week or two, you were just doing upper body workouts or upper body
Yeah.
training, and some kneeling deadlifts. But talk to us a little bit about what the rehab process looked like initially for your Achilles. So obviously you weren't non-weight bearing. So how long were you non-weight bearing?
So I was non-weight bearing according to the protocol for 2 weeks.
Okay.
So non-weight bearing in the boot for 2 weeks, and then partial to full weight bearing in the
Mhm.
boot after that. So during the first non-weight bearing phase, I did upper body and I did open chain leg exercises.
Mhm.
And then once I could weight bear, obviously started with just walking, right? And then
In the
I don't
boot.
want to say I didn't. Yeah, I don't want to say I didn't follow the protocol. You should follow the protocol. But you know, I I think I knew the mechanism of the
Mhm.
injury, right?
Mhm.
So then, as long as I don't repeat the same mechanism in a
Mhm.
sense, which I couldn't anyway,
Right.
and I was in a boot, so a lot of the weight bearing progression is more tolerance based,
Right.
more so than safety based,
Yep.
right? So then,
And I think
so
that
I
that would be, I'm curious to maybe even speak to an orthopedic surgeon about this, but weight bearing status in a non-surgical versus a surgical Achilles rehab. I'm curious what that would be. Is it different? Like, do you feel like, for non-surgical it's more to tolerance versus for surgical it might be like specific percentages in terms of weight
right.
bearing during certain time periods to allow the surgical site to heal? I'm curious, do you have any insight on that?
Not really, but when I had my second opinion, she pretty much said that, if I were to cut you open, say, end of the week, then you're starting from day zero,
Yep.
right? So I lost 2 weeks in a
Right.
sense, right?
Mhm.
And then, so then that wasn't very appealing to me either.
Mhm.
But
Mhm.
in terms of the weight bearing, I'm not really sure. I just feel like once you get cut open, you already, in a sense, hired a surgeon to, give you the surgery. So why not follow?
Right.
whatever the surgeon tells you, right?
Right. Yep. Yep.
So I think if I had gotten the surgery, I probably would have followed it more strictly
Mhm.
potentially
Mhm.
rather than to my tolerance,
Yeah. Mhm.
So, so yeah, so once I was in the weight bearing phase in the boot, I don't know, I think I was on crutches for maybe a day,
Mhm.
right? Oh, toe touch weight bearing, which in the boot is like not possible. So yeah. So then I gotta even up. I don't know if you know what even up. It like goes under your shoe.
Other your
Your other
opposite.
shoe.
Yes,
Yeah,
yep,
yeah, yeah.
yep. So that you
Okay, so
I
I
mean
gotta
that was
even
my
up.
next question is walking in the boot. So I think a lot of people aren't even aware of that. Walking in a
Yeah.
boot, well, first of all, when you have an Achilles rupture, it is the was it your boot in neutral or was it in plantar flexion?
Yeah. So I had 4 wedges about this high
Uh-huh.
in the boot.
Yeah.
Right. So
Yeah.
I'm standing around 5'10" at this point.
Yeah.
I gain a solid 4 inches,
That's so funny. Yeah,
and
so
yeah,
well with the boot on, basically the boot is so built up relative to your other foot that it
right,
puts you in this like very off balanced um
right.
position. So a lot of people end up getting pain when they're in a walking boot up the chain in their knee, their hip, their back. So, just for anyone listening, if you're told to be in a walking boot for whatever reason, a foot surgery, an ankle sprain, whatnot, you can get a little attachment. What's it called?
It's called Even Up. It's
Even
on
up.
Amazon.
Yeah,
Yeah,
a little attachment for your shoe that you for your non-injured side that will bring your non-injured leg up to the same height as the boot so
yeah.
that
At
you're
least as
more
close
even.
as
Yeah,
possible.
yeah,
Yeah,
so that it's less stress distribution throughout your back or
yeah.
hip.
So then I walked down to to the basement one day, and then now I'm fully weight bearing around I don't know 3rd week or 4th week
Mhm.
now. So then I was like, you know what? Let me try to squat. Right? I just had the bar. I had the bar, and then the boot straps you in. Right? So I'm
Mhm.
in plantar flexion, and then the boot then straps you in. So I couldn't even dorsiflex. It
Right.
fixed you. Right?
Mhm.
So I'm like, okay, so what do I do? Right? Okay, all right. Well, I have the uprights from the squat rack, right? And then
Mhm.
I have a safety squat bar,
Right. Yep.
right? So then I loaded the safety squat bar instead of the straight bar,
Uh-huh.
and then I put my bench behind me, and I kind of did like a
Hatfield. Yep.
hat feel squat with the safety squat bar around my neck, so I didn't even have to hold on to the handle,
Mhm.
right? So then I did the bar, and I'm like, this doesn't feel like anything. I'm gonna put a plate on. So I just
Mhm.
put a red on, right? And then okay, still feels pretty decent. I can get to the movement, right?
Mhm.
I'm like, all right, well, I think I can do this. So then I think by the end of the week, I was squatting on the safety squat bar, maybe like 100 kilos.
Mhm.
Yeah. And
That's
then I
pretty
was just
awesome.
like,
This is
yeah,
almost 4 weeks post injury.
yeah, yeah, yeah,
Yeah.
yeah. And then so then I'm like, okay, well, if I can squat, let me try deadlift, right? So I loaded the bar, and then I don't wear shoes around my house. It's
Mhm.
Chinese household thing. But so then I was like, well, I'm not even right now. So what do I do? So I put a bumper plate under my right foot. So then I put a bumper plate under my right foot, and then I started with like an RDL, right, with the bar. So then I'm like, okay, let me just load a plate. So I'm essentially doing like a deficit deadlift,
Mhm.
you know, which is fine, right?
Yep.
Something better than nothing. And then I probably I don't know by the 120 kilos by the end
Mhm.
of the week, kind of, just doing whatever it is I can, right?
Mhm.
And that's kind of how I started getting myself back into training. I just did what I could
Yeah. I
for
mean,
the
I
most
think
part.
this is a really, really good example of how just have to be creative. Everybody's going to respond a little differently. Everybody's body is going to move in a different way. But for the most part,
Right.
when you limit one joint, we all move similarly, but just being creative, like if you are at home and you don't have access to leg press or whatnot, or you just got to get creative. I love that you did the Hatfield squat and deficit deadlifts, and just to not be afraid of loading. I think that so many people are afraid of loading sooner rather than later. And we're always of the mindset to load sooner rather than later. Even if you only did like 90 kilos, or not 90 kilos, 40 kilos for
Yeah.
your deadlift, and did an RDL, not from the ground, like that's something is way better than nothing. And most people, wait until they're cleared to go back to the gym before they do anything. And your doctor is never going to clear you to go back to the gym until you're like PT
Right.
is over, and it has to be included into the PT process. Like your training should be your rehab, is what we always say.
Oh,
Um,
absolutely.
yeah. So I have a question in terms of when you came out of the boot. So
Hmm.
what specifically did you do like specific, like traditional physical therapy stuff for your foot and ankle, or did you use the barbell as really the push for range of motion and strength?
Uh, I probably did the four-way ankles maybe once this entire time. Yeah. So they start you out in the boot right now. I'm wearing first two
Mhm.
weeks, and then fully weight bearing up until you see the doctor again. Which at week like 6.5, I had a negative Thompson test. Yeah, so it attached in like less than 7 weeks, which is crazy to me.
Mhm.
So then from there, you then slowly take out a level of the wedge
Mhm.
each like week per
Mhm.
tolerance per se,
Mhm.
right?
Mhm.
Per tolerance. So I took out one wedge that Friday when I saw the doctor. Right after I saw her, I took out one wedge. Walked around, like, this feels better than being on four wedges, right?
Right.
So then Saturday, I took out another one. Sunday, I took out another one. Monday, I'm in the boot flat, like neutral, right?
Mhm.
Which then the boot came up all the way to my knee,
Mm.
right? So it was kind of like cutting into my knee.
So you're like,
So
to hell with
then,
the boot.
yeah. So then on Tuesday, you know what? I'm just gonna walk. You know.
Mhm.
So then so a lot of people recommend like transitioning into a shoe, right?
Yeah.
But then I'm thinking, well, I just came out of the wedge to go to neutral. Why am I gonna put my foot on like a heel to toe raise again?
Right.
Right?
Yep.
That's to me kind of like regressing, right?
Right.
So then you know what? I'm just gonna walk barefoot, because I'm a big barefoot walking kind of guy,
Mhm. Mhm.
right? But I'm walking barefoot, and then I realized how tender
Mhm.
my foot was from non-weight
Not.
bearing,
Yep. Yep.
right? Yeah, yeah,
Mhm.
yeah. So I look at my heel and then my like metatarsal pads, and then it's like they're all kind of like, I don't know if they shriveled up, but
Yep.
atrophied in a
Yeah.
sense, right?
Yeah.
That your
Yeah.
fat pad really went away,
Uh-huh.
and kind of going back to our point really is, I think sometimes it's worse. The atrophy itself is worse than the injury.
Yes, absolutely. That's
That's
why
right.
we talked about this in our functional anatomy episode with John, that immobilization, and I mean, you have to immobilize
Right.
the ankle in this situation in order for that Achilles to reattach, or if you have a surgical scenario, for that surgery to maintain itself and be protected. But um we almost all scenarios, even after you fracture things and have fracture, like a open reduction, internal fixation, you are moving as much as you can within tolerance and with what the injured site can handle, because not moving and not using it leads to atrophy, and the atrophy and the stiffness that is associated with not moving is harder to regain.
It's worse.
Yeah,
Yeah,
absolutely.
for sure. For
And
sure.
even the sensation changes that you experience, like you hadn't put your foot on the floor. And we even talked about this in the the functional anatomy episode. um there's so many bones and joints in the foot, and it's because of the proprioceptive input that we need to get from our feet.
Right.
And when you're non weight bearing, you lose a lot of that.
And yeah, so kind of tying it back to like my part of rehab is that I realized how tender my foot was. So then what I started to do, well, even when I was in the boot, is I'll take it out like every day for a little
Mhm.
bit, and I'll put my foot on different surfaces, right? So I put it on tile, I
Mhm.
put it on like hardwood floor,
Mhm.
and I put it on carpet
Mhm.
just to desensitize the
Yep.
bottom of my foot.
Absolutely.
Yeah. And then I just kind of like forced myself to walk once I was out of the boot on different surfaces barefoot all the time,
Mhm.
just to kind of like regain that. I don't want to say that it was so sensitive when I first took it out, and that was, I think that's the reason why people tell you to slowly wean, you know, but then I'm like that's gonna take too long. So yeah, so I was essentially walking on like our clinic is like carpet, like high
Mhm.
traffic carpet on
Mhm.
concrete,
Mhm. So it's
So I was
hard.
just walking
Yeah.
on, yeah, so I was walking on that the
Yeah.
first like week, and then by
Mhm.
the end of the week, like it was like pretty good.
Mhm.
It was pretty good. So I would say leading up to about 5 months post uh rupture, walking outside on like on my driveway,
Mhm.
still a little sensitive, but
Yeah.
now it's kind of like nothing.
Yeah. So tell us a little bit about how you regained your range of motion and your strength under the barbell.
Range of motion. I hate to tell you, but I didn't really push it that hard. I did like the wall test,
Mhm.
kind
Mhm.
of like you kneel in front of
Yep.
the wall and put a
Mhm.
hand right,
Yep.
and then I was pretty much able to gain that back. Oof, maybe 10 weeks out, 12
Mhm.
weeks out.
And
Yeah.
you didn't do anything specific for range of motion other than lifting and walking.
Yeah, yeah, nothing like really out of the norm, I would say.
Mhm.
Uh, I did purchase heel lift
Mhm.
in my lifter, so
Yep.
I'm wearing 1 inch lifters because I have a really short torso to begin with.
Yep. Yep.
So then I've always do better squatting in lifters
Mhm.
anyway,
Mhm.
right? So then I tried squatting in my lifters, and in the hole, it was still kind of like, it's kind of tight. I don't want to put too much stretch on it, like too early on, right? So
Mhm.
then I got these uh, heel lifts in my lifter. So I put
Mhm.
you know heel lifts in my lifter. So I'm like an inch and a half from heel to toe drop
Yep. Yep.
now, and kind of just like work my way into that, and really finding the balance between being tipped too forward,
Mhm.
right?
Mhm.
Because you're so high off,
Mhm.
and then still being able to hit depth when I squat.
Did you notice any
And
I mean, I assume there was some type of atrophy in your left leg during this whole process, or did you not really experience much atrophy
oh,
because it was
I mean,
short?
my left leg is still smaller than my
It's
right.
still smaller than your right.
Yeah,
Have you done anything specifically to focus on rebuilding the mass in your left leg?
uh, not, I would say not till more recently. So
Mhm.
maybe leading up to about 8 months, even when
Mhm.
I push a lot of calf raises, the
Mhm.
tendon will get really sore.
Mhm.
So I kind of just like, whatever, right?
What about
So
the quad and the glute?
I would do at least single
Mhm.
leg extension on its
Mhm.
own
Mhm.
regularly.
Mhm. Did
And
you
I did
Yep.
some blood flow restriction stuff
Mhm. Oh, yeah,
early on.
that's yep.
Yeah,
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 that's definitely helpful early on, especially when you can't load it as heavy,
right.
as you want, but you wanna maintain the muscle mass and the strength. Did you experience any, like, shifting in your squat or your deadlift as a result of the injury, or does it kind of feel
Yeah. So going back into your previous question about using barbell for range of motion strength, right? Uh, One of the things that I found actually very helpful, which I didn't really think about it until this happened to me, was how much plantar flexion strength you need for sumo. for sumo deadlift, right?
Mhm.
Because you are essentially starting at neutral
Mhm.
in
And going
sumo,
into
right?
plantar flexion, yeah.
And then going into plantar flexion. And so I was never like a weak lockout guy. Like I have hard time getting it off the floor,
Right.
but
Mhm.
if I can get it off the floor, usually my lockout is pretty seamless, right?
Mhm.
And that's a huge change early on for me. Like having, okay, I get it off the floor, and then all of a sudden I'm kind of like shaking at my lockout because
Mhm.
I just don't have enough plantar flexion strength.
Yeah.
So doing the sumo actually was a really good indirect way
Mhm.
to strengthen my calf without like kind of making my tendon really sore.
Yeah, absolutely. Because
So,
it starts in neutral instead of in
yeah.
dorsiflexion, which is
So it's like an
interesting.
isometric.
Yeah, it's interesting because I remember one time I had a competition, uh, and both my calves cramped right at
Oh,
lockout, and I lost the deadlift. I mean, I didn't drop
yeah.
it, but I got like I pitched forward on the deadlift,
Yeah.
and I mean,
Up and
yeah,
down.
yeah, I never had that happen, and it was just that one competition. I probably had done a water cut or something, and was dehydrated, and both my calves just cramped right at lockout. So
Oh,
yeah, I mean, it's interesting. I really never thought about it that way as using
me
sumo
either.
deadlift.
Yeah.
Typically I think, oh, we'll use the conventional deadlift as our rehab and then transition into sumo for a sumo lifter. But I mean, for an ankle injury, I mean, that makes a lot of sense. And it is
Yeah.
a safer position for the ankle. It's not, a direct calf raise, but you're still loading it.
Right, right, right.
Yeah.
Which was pretty cool. And then for squat, in terms of like shifting, I definitely tend to, in the beginning, I favored my right more,
Mhm.
right? The left felt tighter, and I didn't want to put too much stress on it
Mhm.
early on because
Mhm.
I was kind of during the re-rupture phase.
Mhm.
Even though I know I'm like loaded bilaterally, but
Mhm.
squatting, go from non-weight bearing to squatting, like 120 kilos or something, within 10 weeks is kind of still kind of scary to me, right?
Yeah, absolutely.
So, but I definitely noticed some shifting. And then, over the course of time, I just kept squatting, right? So
Mhm.
then I think at week 12, maybe I had like a really ugly 170 kilo
Mhm.
squat,
Mhm.
in my heel lift and my lifters. But at
Mhm.
least I was able to do it, which kind of felt reassuring to me.
Mhm.
I didn't lose like super much, right?
Right, right.
Right. And then as time went on, I kind of went back just taking the heel lift out as I felt more comfortable.
Yeah.
And I'm at a
So you
point
would
right
would you
now,
drop you would drop the weight back and take the heel lift out and then build back up?
uh I'll kind of I'm like a good tester. I'll like squat one set with the heel lift in and then same weight, and then I'll take the heel lift out
Oh.
and do the same weight. And I'm like, okay, that felt
Living
okay.
dangerously.
Yeah, yeah, yeah. But yeah, and one of the main things that affected me a lot in the beginning, once the weight got heavier, was the walkout was really tough because that's the only time in the squad where
You
I
need
have to
planner.
go single, yeah,
Yeah.
single limb weight bearing,
Yep.
right? Which go from, just walking to now have a bar loaded on your back.
Mhm.
And then I have to step back with my initial walkout in the first maybe 6 months was pretty, it was like the harder part of the lift
Right.
almost,
Yeah.
and so now the other day I can do like supported calf raises. I can do about 100 now.
Okay.
Yeah, I mean, it gets really sore still, but at least I will go from doing 3 to
Yeah.
now
I
100.
mean, and this is typical of Achilles rupture rehab anyway, is like it takes a really long time to recover. Even if you
it
have the
it does.
surgery, it's not like
Yeah,
you go through 16 weeks of rehab and then you're good to go. I think with any of
right,
these major surgeries in the leg, like a labrum repair or ACL reconstruction, quad tendon repair, Achilles tendon repair, they all take time. Like a long time. It's probably 2 years before someone feels like it's unaffected by it, especially if you have good rehab
right.
or you're strong. It's probably like 2 years until someone feels like this doesn't bother me anymore. And so I think you're doing really well, considering, and you've competed twice, right?
Correct. Yep. Yep.
Yeah.
Yep.
So
So
tell us how, when did you decide you were ready to compete? Because I think that, a lot of people, like I said, the whole reason I wanted to have this conversation is because people experience an injury like this and think it's the end, or they
right.
they
Right.
don't develop confidence to compete again and whatnot. So tell us a little bit about the process of, like, I feel good, I want to do a competition. So when did you first feel that? And tell us a little bit about the two competitions and your lifts in those competitions relative to what it was prior to the surgery, to the injury, not surgery, sorry.
Okay. So uh, I probably felt ready maybe like 4 months out. I knew I could put up something like meh, but then I usually compete at least once a year just because I'm the guy that I need something to work towards kind of
Yep.
guy. Like I can't
Mhm.
just like train aimlessly,
Mhm.
so I usually try to compete at least once a year. So then I got hurt earlier in the year,
Mhm.
and then I tore my Achilles. So then I didn't compete at all, like in 2022, leading up to me deciding that you know what, let me do a competition. So I competed on like December 10th, I think, and I
Mhm.
ruptured in July 19th. So just was shy of what, 5 months ish.
Yeah.
Yeah,
Yeah.
right. Yeah,
Mhm.
just shy of 5 months. Yeah, and it was kind of like, okay, I want to say like to prove to myself a little bit, right? Like I can do this kind of
Mhm.
deal, right?
Mhm.
So my best squat prior was a 230 kilos,
Mhm.
which is what 508, I
Mhm.
think. Yeah,
Mhm.
five oh
Around
seven,
there.
508. Yeah, and then my first meet, uh, going back, I squatted 210 kilos, 463. Yeah,
Mhm.
so 90ish%, right?
Yeah, that's pretty awesome
I
in 5
Yeah,
months.
yeah, and then bench. Let's not talk about bench.
Is that your nemesis?
Yeah, yeah, yeah.
Yeah.
It's from the. I want to blame the elbows, but I think
Yeah.
I'm just a bad. Yeah, but I think I'm just a bad bencher.
Well, how much do you
And
weigh? What weight class are you?
uh,
You're like
75
75?
kilos.
Yeah.
Yeah,
Yeah.
165. Yeah.
So you're not a big dude, and that's a big squat, So um that's a big squat. So what is your bench? Just curious.
Oh, so that meet I only put up like 281.
Uh-huh.
Yeah, so like what, one twenty,
127 and a
27
half. Yeah.
point five. Yeah, yeah, yeah. And then deadlift I did what is it, 257.5 kilos. So it was like 568, I think if I know like
Mhm.
kilo to pound. So pretty good, like 595 total. I think it was like
Mhm.
a 1311.
Mhm.
So
Mhm.
uh
Strong
I was
dude.
happy with it. I was happy with it, right? I
Yeah.
especially I hit my opener, and then on my second squat, 250, I stood up like almost like too fast, and then
Yeah.
my left foot kind of like lost some
Yep.
balance at
Yep.
lockout.
Mhm.
So then I kind of like tossed it forward before the
Mhm.
rack command. So
Mhm.
then they didn't, you know, it got called. But then I just I said move forward with my third
Mhm.
with my buddy that was there, and then I just said I'll just make sure I stand up slower this time,
Mhm.
not
Mhm.
not like shoot out of the hole, which then it was good. So then I competed again May of this year,
Mhm. Mhm.
and I opened I think 207.5, so that's what, 458.
Mhm.
All right,
Yeah,
yeah, and
205 is
then yeah,
451. Yeah.
yeah. So then I wanted to squat 4 reds. That was my goal,
Mhm.
right?
Mhm.
4 reds or 225 kilos or 501 if I feel
Mhm.
really good, right? And then second squat came up like an RPE, maybe like 8.5, But then so then we're like moving forward, and all right, 225, put it on the sheet, and then I checked the board, and it was like they didn't give it to me because I guess because of depth, it
Mm.
felt good,
Mhm.
it felt like I hit depth, right?
Mhm.
But then they didn't give it to me. So then we're like, should I move forward with it or should I take the conservative route? So then I was like, you know what? Let me just repeat and just make sure I sink it. So then I repeated and sank the squat and couldn't stand back up.
Oh.
I fought about halfway. Yeah. I fought about halfway and then I'm like, yeah, it's not worth it.
Yep, yep.
So I only went 1 for 3. So, but I was able to squat at least 486, right?
Mhm. Mhm.
So 10 kilos within my best competition squat,
Mhm.
which is you know pretty good. I was happy with it,
Yeah.
even though they didn't give it to me. And then I benched 303, so 137.5. Finally, with the
Nice.
2 hour,
Nice.
yeah, finally with the 2 hour weigh-in, I was able to kind of get over that
Do you cut
hurdle.
weight for competition?
Maybe like 3 pounds.
Okay. Yeah, that's not bad.
Yeah, yeah, yeah. Yeah. I walk around like just a little under 170.
Mhm.
Yeah, I don't want to cut too much because I'm getting older and stuff. I don't want to be too heavy either.
Yeah,
I
exactly.
feel like a lot of people are like, oh, you want to hit through the plateau, just gain more weight.
Yep, no. You
And
don't
I'm
have to
kind of
do
like,
that.
yeah, but
Yeah.
I'm not 21.
Yeah, right? It
Yeah,
doesn't come off
uh,
easily as you get older.
yeah, exactly.
Goes
Because
on
I'm there,
easily.
I'm finishing kids' cakes, and I got 5 cakes I have to end up finishing at a party.
Uh-huh.
You
Yep,
know,
there you go. 5
so
kids, 5 cakes.
yeah, and
5
then
times a year.
right, and then deadlift I didn't do as well. I opened with 240 and had a calf cramp on left.
Mhm.
Yeah. And then hit 240 again. And then for the third, I went more conservative. I
Mhm.
pulled 451, 551, so
Mhm.
250.
Mhm.
Yeah. So a little bit under what I did back in December. So same total,
Yep.
which I was kind of mad about, like
Eh,
595, 1311. I'm like, come on. Like I
I know it would
really
have been
wanted
nice if you
to,
had like a 2.5 kilo
yeah,
PR.
exactly. Yeah.
Just that little PR. Even if things didn't go the right way, you always want that little PR
I
somewhere.
kind
But
of went in hoping to like qualify for nationals,
mhm.
which at my weight class it's like 625,
Mhm.
you know,
And what was your
uh
total on that meet?
595.
All right. Well, honestly, if you had a good day, you probably would have hit it. Um,
I think the strength was there,
yeah. Yeah.
just I'm notorious to kind of peak too early or something, just get
Mm.
hurt at the knee, right?
Yep.
Which
Yep.
now, like looking back nowadays, I've in the future, I think I'm
Mhm.
gonna keep my peak shorter.
Yes. Yes.
Yeah. So I think
Yeah,
I'm
I
gonna
definitely
just
think keeping track of your time to peak is really important because either you peak too early or you peak too late. You know,
yeah. So
and
I
I
think
think peaking. I mean, either of those can set you up for an injury in the meet. But if you
yeah,
peak, if you peak too late, then you're trying to hit numbers that you're not ready for in competition and
right.
can get hurt. And if you peak too early and you try and go and hit numbers that you're too tired to hit, you can get injured too. So, um,
Yeah.
all
So
right.
yeah,
Uh,
so not too I would say not super happy about the second meet, but I would say overall, shoot, I was 10 months out or 11 months out ish,
mhm.
so I don't want to say, slow my roll a little
Yeah, yeah. I
bit.
mean, listen,
Yeah.
you can say that. I think sometimes we have to. I think it's good to be able to be honest with ourselves, and I think as physical therapists, it's kind of like a blessing and a curse. We can be honest, but also we don't want to be honest because we're the
Right.
patient. So we can be honest, but it's hard to accept that sometimes. But I mean, I think would you say that where do you feel you are in your rehab process right now?
Uh, so I think from a powerlifting perspective, I'm pretty much back on track.
Mhm.
I'm pretty much back on track. I have a good excuse as if I mess up, I'll say, oh, I just my,
It's
you
my
know,
shit,
yeah,
my calf,
it's
yeah.
my Achilles. Yeah, but honestly, from a powerlifting perspective, I don't think I have any excuses anymore.
Mhm.
My deadlift's been wonky, but that's a separate issue. It's not
Mhm.
related to the Achilles.
Mhm.
So my sumo has been kind of wonky because I think partially because I did a lot of conventional early on because I
Mhm.
couldn't do
Mhm.
sumo,
Mhm.
you know. So my motor pattern
Mhm.
and the way I set up for sumo kind of turned into the how I set up for conventional, which kind of has been kind of like throwing me off a little bit.
Mhm. Mhm. I
But
used
from
to
a
be a su
powerlifting,
No,
go ahead.
sorry, go. I used to be a sumo puller, and I've been pulling conventional, so I'm curious to see how it feels if I go back to sumo, now that I
Yeah.
haven't done that in a while.
But from a powerlifting perspective, pretty much back to normal. I started integrating more plyos
Well, I was going to ask you
this
about that.
last month.
Yeah,
Yeah,
so in terms of, because, one thing that John and I talked about in the functional anatomy episode is a lot of, I would say like 95% of the foot and ankle injuries in powerlifting are not injuries that happen in powerlifting. They're just injuries that happen outside of lifting but affect powerlifting. Kinds of
right,
injuries we see to the foot and ankle are like tripping over the platform or dropping a plate on your foot.
right,
So,
right, right.
obviously this injury happened to you playing basketball, which is probably something that you'd been playing, all your life basically. So, in terms of that, uh what has the process been like, and has there been a process for returning to basketball since this happened?
Uh, so I just started doing more plyos. I would say, being I don't have as much power in my left still compared to the
Mhm.
right, obviously. Uh, but I think I'm gonna play in the fall again,
Mhm.
just in my old man, 35 plus league.
Mhm.
All a bunch of washed up people. Yeah, but
I'm curious, have you ever done power cleans?
uh, I used to more,
Mhm.
but uh, my left elbow doesn't really
Ah.
bend that much,
Mhm.
so like
Mhm.
I can't really touch my shoulder. Like my right one, I can.
Uh-huh.
You see the
Yep.
left,
Yep.
yeah, and that's from when I like dislocated my elbow.
Right, right. Do you
Yeah,
have
when I was
equal
younger.
extension on both sides?
No, I don't know if you can tell, but
Yeah, I can
the
see
left
your
one,
left is
yeah, it doesn't
yeah.
really,
The
yeah,
whole left
doesn't
side of
really,
you is messed up.
pretty much, yeah, yeah, yeah. But so I used to do a lot of front squats, like
Mhm.
early on when I had more mobility,
Mhm.
but but like the more I train front squats, like, and then my elbow's hurting for the
Mhm.
next like 3 days, so it's
Mhm.
kind of like risk to
It's not
reward.
worth it.
It's
Yeah.
yeah, it
Yeah.
wasn't worth it, and so then I just started doing safety bar squats, which I
Yes.
feel like it kind of puts you in the same like camber position,
Yeah, yeah. And a lot of people,
right?
I've seen people do safety bar squats with it turned around.
Yeah,
I don't know.
I'm
I've
not a huge fan. Yeah,
yeah, I know it's a little scary to
yeah,
think about, but
yeah. I'm just like, yeah, but
yeah, no.
but
So you haven't really returned to basketball, more out of, is that more of an interest thing than rehab holding you back?
uh, haven't had opportunity, I would say.
More so
Yeah,
because of family life and work than anything
right,
else?
right, right. Like the league hasn't, league didn't start back up yet. Number
Mhm.
one, getting uh people to play
Mhm.
is a big thing. Like our
Mhm.
team usually has like, I always tell the organizer, that our team captain, like, dude, get like 10 people. We're like 35. No one can run around anymore like that. Like no
Yeah,
one's full
yeah.
court pressing, right? But
Well, I mean,
he's
that's interesting. How many people were on your team when you hurt your Achilles, and how long had you been playing in that particular game at 10 p.m.,
right. So he always worries about like playing time, right?
Mhm.
Like everybody's paying the same price, so then he wants like fair playing time, right? Which, okay, I understand, rec league, right? But then, at our age, everyone on the team has kids, right? At least one kid, right? So not everyone shows up, right? So you get 8 people, or lucky if we get 5,
Mhm.
right? So that day in particular, we only have 5 people, and then
So you're
I
playing the whole
went
time.
down there. Yeah, exactly.
Yep.
Yeah, and I'm like as much as I'm out of cardio shape,
Yeah.
I'm one of the better ones on the
Mhm.
team in terms of
Mhm.
cardio.
Mhm.
So that definitely played a huge role into like the fatigue aspect.
Mhm.
Just every week we're playing 5 or 6, you know. So yeah, just
Yeah,
but
I
I think
mean,
I'll go back to play
yeah.
again.
Yeah.
I don't say I'm not scared. My wife was like, is it worth it? I'm like, well, I didn't work this hard just so I can not play,
Right. Yeah,
right?
exactly.
So and
Um, yep.
so and then so she's like, what if you tear your right one? I'm like, then I'll know exactly what to do this time,
Oh God.
right? Yeah,
Yeah.
I just can't drive. That would be
Yeah,
sucky.
that would be
Yeah,
definitely.
that would be.
Yeah. All right, Martin. I want to this has been a really incredible conversation, and there's one last question that I have for
Yeah.
you. What is the biggest thing that you learned from this injury?
Uh, I would say probably like definitely patience, right?
Mhm.
Patience is huge, uh, and I would say to all the non-healthcare professionals out there,
Mhm.
like really weigh your options with surgery, in a sense,
Mhm.
right? Because the surgeons can be very convincing,
Mhm.
right? And one of my major thing when I ended up deciding going this route was that he can fix the surgery like we talked about, right? But
Mhm.
he's not going to turn back the clock,
Right.
right? Like he's not going to reattach my Achilles and then all of a sudden I go from 37, washed up to 27 at the
Right.
peak again in my
Right.
athleticism, right?
Right.
So I'm not a professional athlete by any means. Like my paycheck doesn't depend on whether or not I get this fixed,
Mhm.
right? So if the outcome, the long term outcome is the same, I really think that people should just work hard at rehab if you
Mhm.
had the non surgical option,
Yeah.
and I would do it all over again,
Mhm.
non op, with the exception of I will probably start weight bearing on day one
Interesting.
instead of taking those first 2 weeks off.
Mm.
I think it was
This is
safe
not
enough for
medical
me to weight
advice.
bear.
Just
Yeah.
putting that out there. This
Well,
is not.
but I think a lot of the protocol and research right now
Yes.
out there in the non-operative route is
Mhm.
early weight bearing is
Mhm.
key.
Yeah.
And
Yeah.
early weight bearing, I mean, your foot is locked in that position. It's
Right.
not going to go anywhere
Right.
for the most
Yeah.
part. And there are protocols that let you weight bear
Right.
on the first day.
Yeah.
With the exception, if you go to a surgeon, he has a protocol for you.
Right.
Follow the protocol.
Yeah, and
Right.
we
But
actually have a podcast with a surgeon, upper extremity surgeon, and we talk about where these protocols come from, and it's really more about protection of the surgical repair than
right.
anything else. Um,
Yeah. And I didn't have
so
surgery. So
yeah, exactly. So move it or lose it is something we love
yeah.
to say. Motion is lotion. Motion is
Yeah. And
preserving.
even in if you see a lot of the shoulder stuff nowadays,
Hmm.
they don't put people in the sling for as
Not
long
as
anymore.
much. Yeah,
Remember, it used to be when we first got out of school, it
eight
was like
weeks.
everyone is in the sling 6 to 8 weeks.
Yep.
Right now, it's like a week.
Yep, yep.
Right?
I'm
Sometimes
always
they
I
show up with
it's
no
still
sling.
it's still weird when people show up with no sling and I'm like, "Wait a second, did
Yeah,
your shirt, cuz we come from that generation where everybody's put in a sling and now it's like
yeah,
not some and I'm like, "Are you sure?"
yeah. I'm
um
like, your surgeon say you can take it off. They're like, yeah, yeah, yeah. I'm like, okay, yeah.
um but
So
I think what you said about weighing your options is really key. And we talk a lot on this podcast about the narratives that any medical or authoritative professional um, puts out there, and we definitely, as physical therapists, and I'm sure you feel the same, we, when we're involved, try and be our clients and our patients advocates as much as possible and help them weigh options. But not everybody has someone who can help them weigh their options. So I definitely think what you said about getting more, like, you got two opinions, you did your
Yeah.
research, you spoke to your friends who happen to be physical therapists as well. I think it's important, just like you said, to weigh your options, speak to people who are knowledgeable about it in different from different perspectives. You spoke to a
Yeah.
surgeon who goes the non-surgical route. You spoke to a surgeon who goes the surgical route. You spoke to physical therapists who have different experiences with these types of things, and also experiences with powerlifting. And you yourself are a powerlifter, and and physical therapist, and were able to kind of chime in with your own knowledge about it as well. So I
Yeah.
think that that's huge.
And I think it's not that the first surgeon just wanted to cut me open. I think a lot of times people are like, oh, they just want to cut you. And it's like,
Surgeons
it's
do
not that.
surgery, yeah.
Yeah. And I don't think it's that. It's just that's how his education
Mhm. Mhm.
told him that was he thought was the best option for me.
Mhm.
Right.
Mhm.
So it's not that I believe that he still had my,
Best
you know,
interest.
uh, yeah, best interest in his heart. It's just
Mhm.
he knows surgery,
Mhm.
right? He's not exposed to the non-operative route
Mhm.
as well compared to my second
Mhm.
orthopedic doctor, right? So
Mhm.
he seemed a little bit on the pushier side,
Mhm.
right? But then still thinking not that just because he wants to cut me open. I don't hold him in a sense like at fault for
Mhm.
telling me that I should get surgery.
Yeah. Yeah.
You
No,
know, it's
exactly, but that's definitely why um you should get more opinions, so that you
right,
know what your options are, and you, as the person experiencing the injury, can weigh your options and decide what's best for you, your family, your sport, with
right,
the information that you have from the professionals that you're speaking with, for sure.
right. Yeah, and definitely, they can't make you stronger, right? Like only you can train your muscle, right?
Yep.
And that's a lot of times patients will come in, oh, you're gonna be mad at me. I didn't do my exercises. I'm like, well, it's not my knee.
Yeah.
You know what I
Yeah.
mean? Like it's your knee. You have to, in a sense, hold yourself accountable
Mhm.
for where you want to end up, with this injury, right?
Yep.
You can, in a sense, play the victim, right?
Mhm.
Thinking that you will never get back up, or you can at least try your best and then knowing, okay, well, I tried my best and I'm just not where I used to be, and be mentally okay with that. At least I
Mhm.
tried,
Mhm.
right? But
Mhm.
no one can do the rehab and the strengthening for you except for yourself,
Right. Exactly.
right? Or else it will all be strong. Shoot,
I know. I know.
right? Yeah, I wish I could just, yeah,
I know. Imagine.
right,
No, I think that's key, and I think what you said is like, people. The classic physical therapy patient that comes out of surgery and they're like, it hurts more, or I don't feel any better. Why do I feel the same? Or it feels different. Like I can use it better, but it still hurts. Like, why isn't it better? I'm like, well, because they didn't fix the total problem. They just repaired
right,
the tendon or the labrum, or they cleaned out some of the irritants in the joint. They didn't fix the out the external problems that are contributing to the internal problem, you
right.
know?
Which, as we now know, pain, right? Pain is like multifactorial, right?
Mhm.
And a lot of it, as I train and treat, it's really like load intolerant,
Yeah, yeah.
right? It's really load intolerant. It's not as much like the anatomical, uh, like wear and tear
Right.
anymore, in my opinion.
Right,
In my opinion,
absolutely. Yeah, no, no, no,
I
I
think
agree with you.
it's load intolerant,
Yes,
right?
absolutely.
It's
It's
like
being
you just can't handle
unprepared.
it right now.
Exactly. You're unprepared, or you're over fatigued, or
Right,
you've been in
right,
that position too long. Like they say, no posture is bad posture. It's the position that
right.
you're in for too long that becomes
The
intolerable.
problem, yeah,
Yeah,
that's how people get
exactly.
hurt sleeping.
Yes.
Yeah,
Or
I woke up with a
sitting.
crooked neck.
Oh my
Yeah,
God, falling asleep in the car. I don't know how
yeah.
kids do it. They fall asleep in
Oh,
like the street, and then they wake up and
yeah,
they're
I
just
know.
fine. And if I fell
Yeah,
asleep like that, I'd be in agony for like
right.
days.
So,
Be like, I can't
yeah,
straighten my
so
neck out.
a a lot of the narratives out there, it's it's slowly changing, definitely for sure.
Hmm.
But it's still getting through to some of the patients is tough. Ah, surgeon told me I have knees of 90-year-olds. Like, I know 90-year-olds that have good knees.
Right, exactly. I know 90-year-olds that are still out. There's that 101-year-old that was all over social media because she ran like a 5K or a 10K or
Yeah,
something like that.
yeah, yeah,
I'm like, yeah, okay, so are your knees like that 90-year-old or the one who
yeah.
is like,
Right, right, right.
which 90-year-old? Yeah, so everyone's different. All right,
So
Martin,
definitely.
it has been a fabulous experience speaking with you about your injury and your recovery. Obviously, we've had some chats about it, and I've watched you on social media as you've come back from this pretty massive injury. So, thank you so much for joining me on the PRS podcast. I know a lot of people are going to benefit from this episode, physical therapists, coaches, and lifters, or just the general population who listens to our podcast.
Washed up. Yeah.
Washed up now.
Yeah.
Once you turn 40, you go into masters. So you and my
Yeah.
husband are
I know
waiting.
that's what I'm trying to cruise on. Just
Yeah, right.
cruise until I'm a
Cruise on
master's
into
lifter.
masters. Yep.
Yeah.
But where can people find you to connect with you if they have questions or they just want to keep following your journey? Where can they connect with
Uh
you?
well I my Instagram is
Hmm.
needles and deadlifts with the
Oh yes,
underscore in between. Yeah,
needles
yeah,
and deadlifts.
yeah.
We'll
Yeah.
put that in the
So
show notes description for
yeah,
you
so
guys.
it's funny because I do dry needling.
Hmm.
And then one of the jokes is always, people come in and, oh, my back hurts. I'm like, oh, just needle them and then just go tell them to do some deadlifts. They'll probably feel better in a couple. So that's kind of how the name came
Uh-huh.
about. So like, I just
Uh-huh.
needle them and then go do some deads and you should probably feel pretty good in about a month.
I love it.
So that's where they can find me. And I'm not super active on social media.
Uh-huh.
Uh, but I'll post my training on there,
Yeah.
you know,
Oh, and Martin,
and
you're also in our free Facebook group, the Secret Society of Barbell Mastery.
that's right.
And I
Yeah.
think I have you labeled as an expert. Did I invite you as an expert?
Oh,
No, I didn't.
I don't know.
Oh,
I'm not sure.
I think I invited like all the physical
Okay.
therapists in our group. So if you didn't accept that invitation, go and accept that invitation
Okay.
to be an
Sounds
expert in
good.
our Facebook group. But yeah, Martin's in our Facebook group. He chimes in on a lot of the questions, a lot of the video reviews. So you can connect with him there also. Again, I'll link
Yeah.
that in the show notes as well. So I'll link his Instagram and our Facebook group. And again,
Yeah.
feel free to contact him in our Facebook group, or I
Yep.
guess just shoot him a message on social media if you have
Yeah.
questions. And
I'm
yep.
I'm happy to answer any Achilles stuff.
Yeah.
I'm on like 2 different Achilles group on Facebook,
Uh-huh.
and just like, just, I don't want to say getting people to go to non-op route, but
Uh-huh.
telling them that
It's an
there
option.
is it is a good option,
Yeah. Yeah.
if you're the good candidate for it.
Right,
Yeah.
exactly. All right, Martin, thank you
All
so
right.
much, and we'll talk to you
Thank
soon.
you, thank you, thank you for having me.
Of
Shoot.
course.